David Singh is Deputy Chairman at Fullerton Health and joins us right here in Hong Kong today. David, welcome to the show. Congratulations, first of all. It's the announcement just went out seconds ago, and very, very interesting. You're getting in at essentially what is the ground level. A lot of people are surprised in a country as advanced, as rich as China, they don't have the healthcare system to speak of, right?
Well, thank you, Bernie. Thanks for having me, first of all. Morning. You're right. I think first and foremost, we are quite excited. We do think that we can play a role in the evolution of Chinese healthcare market. They do have a healthcare system, but obviously it's rapidly evolving with the advent of tech, the advent of data that's going to fundamentally transform healthcare in China. Our partnership with Ping An is quite transformational. It's 3 years in the making, and this is a culmination of 3 years of work with Ping An. We look forward to working with them. We are Ping An's largest overseas healthcare investment to date. We think that this partnership brings together the best of health, which is in our case Fullerton Health for managed care, right, and tech in terms of Ping An. If I may share a little bit about the opportunity for China. If you look at the Chinese healthcare market, by 2050, UN estimates that a quarter of the population in China will be over 65. In the next 20 years alone, to 2037, the proportion of elderly population in China is expected to double from 10 to 20%. Now, what's also very interesting for us to understand is that at the end of 2016, 300 million Chinese were diagnosed with chronic diseases, which means cardiovascular, cancer, as well as diabetes. Now, that's extremely, extremely fundamental and critical. Right. So our aim at Fullerton Health, really as part of our mission to deliver affordable and accessible healthcare across Asia, is you can't ignore China, right, as a market. Right. And that's why our partnership with Ping An is going to be extremely groundbreaking.
The issues in China are very, very well known. It's a healthcare system that is structured with very, very odd incentives that creates an environment where doctors are underpaid, and they're driven to prescribe, certain medications because there is an incentive scheme there. I mean, a lot of the incentives are structured in the wrong way. I'm assuming you at Fullerton, you folks at Fullerton are not working within the existing framework. You want to improve on that, right? Because the existing framework is not sustainable.
Well, I think first of all, that's absolutely spot on. And I think if you look at the last 36 months worth of legislation and policies that have been pushed out by the leadership, it shows an acute awareness of reform that's needed in the healthcare system, and it's moving in the right direction. Where we see ourselves playing is really augmenting that direction in healthcare. So one of the things that I think Ping An has seen in us is really bringing the established managed care model outside of China, say from Singapore, from Hong Kong, from the US, to adapt that to the Chinese healthcare system. So to your point, are we seeing the play in or out? I think we're seeing the play with the Chinese healthcare system evolution.
Right. When I think of where Fullerton is based in Singapore, I think of a very small city-state that punches way above its weight. Parkway, years ago, made an entry into Hong Kong. Glen Eagles just opened with the newest private hospital on the west end of the island. Are those the models? I mean, is that the model that Fullerton is going to take within China?
That's not the model we'll take. We are in the managed care model. Right. So from our perspective, we care about two things. We care about the entire care continuum for the patients, which means value of care, which means having good financial but also health outcomes for them as well. The second thing we care a lot about is actually the affordability and accessibility of care. And so from our perspective, our stated ambition within 5 years is to manage 100 million lives across Asia Pacific. And that's important for us. With scale, with technology, allows us to result in better outcomes. At the end of the day, that results in a more sustainable growth of healthcare in Asia, frankly speaking.
Right. And David, finally, Emily and I were talking just yesterday about a coming IPO in the form of a company called Ping An Good Doctor, which is, boiled down, simplistically, it's telemedicine, but to take advantage of technology to improve healthcare access for many. Is this going to be part of the solution as well?
Absolutely. We think that Ping An Good Doctor, together with the other Ping An subsidiaries like Ping An Health Insurance, as well as Ping An Wanjia, who are all our partners, I think they will play an important role in the ecosystem with us. Where we see ourselves fitting in this is really to play a bit part with them to grow together. I think what's also important is, you would have seen a release with Good Doctor last week, is they are China's largest with 180 million registered users on an online basis. Where we'll come in to augment is really on an offline basis with best-in-class international standards of managed care operations. That's where we're good at with 3,000 medical professionals self-employed within our system, doctors as well as nurses.
Right.
I think that's where we can add some value.
Wonderful. David, congratulations. Best
you
of
so
luck
much.
with this venture. Okay, you're not a second too soon. China really needs this sort of thing. David Sin, Deputy Chairman of Fullerton Health, with us on the program.